So brain tumors are a pretty common cause of seizures. And seizures occur in about 50 to 80% of all brain tumor patients and is commonly a presenting symptom. This is seen more often in lower grade gliomas versus higher grade tumors such as glioblastomas, but can be seen in a wide range of tumors that arise within the brain, including meningiomas as well as metastatic disease from elsewhere in the body. So it's a symptom of the tumor as opposed to sort of anything, just like a headache or some weakness or changes in speech. And so similar to any other function with the tumor and symptom and sign related to the tumor is it's all about real estate. It's all about the location in the brain. And so there are certain areas in the brain that are more predisposed to seizures and some areas that are less predisposed. So here on the right side, we have a picture of a brain. So some areas are not actually really associated with seizures. The brain stem and the cerebellum are not really areas of the brain that cause seizures. The most common area that can cause seizures is the temporal lobe. And this may manifest as a wide variety of different symptoms. This may seem very much like a panic attack with a flushed feeling, an actual increase in heart rate, sweaty palms, nausea. The temporal lobe on the left side of our brain, for most of us who are right-handed, may manifest as speech arrest and not being able to talk. Seizures that come from the occipital lobe, which is where the vision cortex is in our brains, may be hallucinations or kaleidoscope-like experiences. The parietal lobe and the frontal lobes are the areas that respectively involve sensation as well as motor activity within the brain. And so this is an example of what's called a homunculus. And so within both the motor cortex in the frontal lobe of the brain and the sensory cortex in the parietal lobe of the brain, each aspect of our bodies is displayed and marched out within the actual brain cortex. So the leg is involved in the middle part of the brain, and then it extends out to the arm and the hand, which is represented by a large area of the brain, as well as then down to the face and even the tongue. And so I show you this because a seizure from a tumor that's located within a particular area of the brain may actually start with abnormal movement or abnormal sensations, and then will spread throughout different parts of the brain, depending on how far the seizure may go. And so that may be why some people experience a seizure sensation or a motor activity within their face that then may spread to their hand or vice versa from the hand down to the leg. So just to have a bit of an understanding as to why that spread occurs, I think is helpful. And seizures most hopefully are stereotyped. So seizures based on brain tumors typically recur from the same location. And so the symptoms are going to be repetitive over and over again, as far as their semiology, as far as the manifestation. So if you, for example, would not likely have a seizure in your right hand and your left foot, because those are not necessarily things that are anatomically located together in the brain. So to talk a little bit about a seizure, I think there's an analogy that I found to be helpful that I think most of us who live in Northern California or lots of parts of the West can sort of relate to. And I think it's also important to notice that most seizures last within about 2 minutes. So the majority of seizures are self-isolating and are incomplete within about a 2-minute period of time. But a seizure is kind of like a wildfire. This is an analogy that I've been using now for several years, and I think it helps sort of describe what's happening in the brain. So the aura or the prodrome is the spark, campfire or whatever may be the instance that creates the fire. And then as that electrical property extends, as the sort of fire grows, then you end up with this seizure. And depending on how far that wildfire spreads, depends on how severe the seizure is. So a seizure may literally only be just a couple of finger twitching movements, which is a very small seizure localized in the brain, versus something that's a much more generalized broad seizure like those grand mal seizures that we talked about earlier, where you may lose consciousness and completely pass out. That's a larger wildfire that sort of briefly spread all over the brain. And then once the seizure is over, I think something that happens pretty commonly is sort of that scar that happens a little after the seizure is over, similarly to a scarred forest after a wildfire, which again, I think we can all relate to. And so that may really manifest as being unable to talk very well, numbness or weakness of that affected limb, a blind spot in your vision. But over the course of a couple of minutes to hours to occasionally days, that forest will regrow. So it's a much quicker time frame, of course, than you would experience within an actual wildfire. But these are just sort of the natural history of how things can progress over time. So as that area of the brain from the seizure burns out, then there can be a loss of function, almost like a stroke, not structurally like a stroke, but it may appear that way to an observer. But over the course of just a few minutes, up to a few days, all of that can grow back. This is a picture from Tahoe over the 4th of July weekend. So this can all grow back and everything can sort of be back to normal in a pretty quick period of time.